This afternoon we'll have two capstone defenses. Our first is with Ms. Zoe Thomas, and her topic is early screening for breast cancer could help prevent more terminal stages of breast cancer in young women. Please welcome Ms. Thomas.
Within days after her 40th birthday, Stephanie Cosby scheduled an appointment to receive a mammogram. During her exam, the mammogram tech informed her that she would most likely be called in again. Stephanie said, quote, "When I returned to the follow-up mammogram, they found a lump that no one had been able to feel, including myself, during my monthly self-breast exams. A few days later, I had a breast biopsy. On a Monday afternoon in August, the radiologist called me and told me I had breast cancer. The lump could not be felt, the cancer was at an early stage, and I had no signs or symptoms," end quote. 15 days after Stephanie was diagnosed, her mother was also diagnosed with breast cancer. Stephanie's family history quickly made itself known. After doing her own research, consulting with many doctors, oncologists, radiation therapists, surgeons, and plastic surgeons, Stephanie chose to go forward with a bilateral mastectomy, meaning she would have both breasts surgically removed. After surgery, Stephanie was declared cancer-free, and there was no need of radiation, chemotherapy, or any other medication. Stephanie's experience shows the benefits of early screening. Early screening in young women can help prevent more terminal stages in breast cancer. In order to determine this, it is important to first look at the statistics in the United States, and then to look at the benefits and the consequences of early and late screening. On average, 1 in every 8 women are diagnosed with invasive breast cancer over the course of their life. As of January 2022, 3.8 billion women have been diagnosed with invasive breast cancer, including those who are currently going through treatment and those who have already finished their treatment. The U.S. Preventive Services Task Force, also known as the USPSTF, which is in favor of late screening, believes that screening later is more beneficial because it avoids false positives and overdiagnosis. On the other hand, the American Cancer Society, also known as the ACS, supports the idea that when cancer is found earlier on through early treatment, the cancer can be found and treatment can be started at a more successful time. Ultimately, early screening is ethically the most advantageous mode of treatment. To understand how early screening is important, it is first important to understand how breast cancer forms and the options that women have for screening. Breast cancer is a malignant tumor caused by an uncontrolled growth of breast cells. Normally, the tumor can be found through an X-ray, such as a mammogram, or felt as a lump. Though sometimes the cancer can be found through a lump, most cases are only found through screening. These screenings have the potential to find cancer before it is at a late or terminal stage. Cancer spreads when it goes into the bloodstreams and to the lymphatic system. It is then carried to other places of the body. There is a higher chance that cancer is spread when it enters into the lymph nodes. Out of all the options available for women for screening, mammograms are the most important one. Mammograms are the screening, because mammograms are the only screening that results in death reduction. Digital mammograms produce an image from the mammogram onto an electronic computer, and it can show abnormalities more clearly. Not all organizations or doctors are in favor of late screening or early screening. The USPSTF, which is in favor of late screening, acknowledges that there is sufficient evidence showing that screening at the age of 40 to 47 reduces death rates from cancer. They argue, however, the most important harm of early screening is the diagnosis and treatment of non-invasive and invasive breast cancer that would otherwise not have become a threat to a woman's health, or even apparent during her lifetime. That is, overdiagnosis and overtreatment. False positive results are common and lead to unnecessary and sometimes follow-up testing that with the potential for psychological harms, such as anxiety, end quote. The USPSTF believes that it is better to start later screening to avoid these harms associated with early screening. When women go through early screening, they will receive the same amount of biopsies and callbacks as women in an older age group. But those who are in the older age group will more likely be actually diagnosed with invasive cancer rather than having a positive or overdiagnosis. Therefore, the benefits improve with the age of the patients. The USPSTF concludes, quote, women in their 40s must weigh a very important but infrequent benefit, which is a reduction in breast cancer deaths, against a group of meaningful and more common harms, overdiagnosis and overtreatment, unnecessary and sometimes invasive follow-ups, psychological harms associated with false positive test results, and false reassurance from false negative test results, end quote. But this doesn't mean that early screening should be discouraged. The American Cancer Society, which is in favor of early screening, suggests 3 things for those at average risk. Between the age of 40 to 44, women should have the option to start annual screening. From the age of 45 to 54, women should be screened annually. And starting at the age of 55, women can start biannual mammograms or continue with annual screening. The ACS states, finding breast cancer early on and getting state-of-the-art cancer treatment are the most important strategies to prevent death from breast cancer. Breast cancer that's found early when it's small and has not spread is easy to treat more successfully, end quote. The National Comprehensive Cancer Network, also known as the NCCN, acknowledges that the main purpose for early screening at an early age in women with an average risk is to be able to detect the cancer in advance if the woman has it. Find it earlier on, the deaths that correspond with breast cancer decreases. Finding breast cancer early and getting earlier treatment is the best way to prevent deaths and more intensive treatment. It is easier to treat cancer when it's found early on, small, and has not had the chance to spread. Starting annual screening earlier in age is the most dependable way to find breast cancer in asymptomatic women as soon as possible. When breast cancer is found because symptoms have arisen, the cancer tends to be larger and in a more terminal stage. Guidelines that recommend later screening starting at the age of 50 place a heavy emphasis on the harms of mammogram, specifically with false positives and overdiagnosis. But many women do not see false positives and overdiagnosis as a harm. In a study, 69% of women thought that the false positives and overdiagnosis were acceptable in mammograms for saving a life. According to the NCCN panel, the more severe harm is finding cancer at a more terminal stage because the patient waited for later screening. Those who consider false positives as a main harm of mammogram screening consider the mental and social consequences as a main negative outcome of false positives. The NCCN panel strongly believes that the risk of false positives and overdiagnosis outcomes are counterbalanced by the chances of death being reduced when it comes to determining the age of starting screening. Sensitivity in screening is the reason why so many women have false positives, overdiagnosis, and callbacks. Sensitivity gives the screening the ability to detect and pick up on anything in the breast that may be abnormal. Because of the sensitivity, many women are called back to receive further screening, like an ultrasound or an MRI. Returning to the introduction of the story, unfortunately, Stephanie's mother did not seek care for her symptoms, and quickly enough, and passed away 3 weeks after Stephanie's surgery. Because of Stephanie's decision to start early screening, despite no prior family history, she was able to experience the fruit with early screening, getting diagnosed in an early stage before her cancer was terminal, and being able to start treatment at the most successful time. Her mother, though, waited to screen until she was at a later age, and was not able to receive effective treatment. The author of Mammograms and Early Breast Cancer Detection and the director of Mercy Breast Center in Oklahoma, Alan B. Hollingsworth, concludes this argument well. Quote, someday a woman will feel a breast lump that is diagnosed as malignant. Then she will receive a sophisticated, personalized treatment based on tumor biology, and the breast cancer will be gone for good, even if it has already spread outside of the breast. Or perhaps all women will be immunized against breast cancer early in life. When that day comes, there will be no need to screen. Until then, however, we are faced with early diagnosis as one of the ways to lower the number of deaths due to breast cancer." End quote. Early screening is the most dependable way to catch breast cancer before it reaches a terminal stage. Tumors can take up to several years before it shows signs or symptoms. With early screenings, doctors are able to see any tumors before a woman is able to feel them or see symptoms arise. Screening early and treating a disease in a curable phase results in fewer individuals dying from that disease, which in this case is breast cancer. Therefore, the main focus of screening is to save lives. It is important for doctors to begin to educate young women about breast cancer, the risk factors, and the positive effects of starting screening at an early age. When physicians take the Hippocratic Oath, they vow to uphold specific ethical standards. Towards the end of the oath, the doctors recite, quote, "I will prevent disease whenever I can, for prevention is preferable to cure," end quote. By doctors advocating to start screening at the age of 40, they are advocating for the value of life and the dignity of a woman, and they are upholding the oath that they vowed to keep. Thank you.